Hi, it's Deb from Global Travel and Medical here again. Interestingly, on the news, we've got the same old story back again. That is the care in the corridor issue that has been rumbling on now for a good 8 to 10 years, if not longer. Very interesting. I can remember as a registered nurse myself, working both in the NHS and as a bank nurse and as an agency nurse. Now, what is a bank nurse? A bank nurse is somebody who is attached to a particular hospital but works extra or instead of having a full-time contract. So you're still doing the same work, you're still employed, but you're sort of like an added extra, as it were, and you just work for that hospital. Whereas as an agency nurse, your contract is with an external agency and you work at hospitals anywhere all over the country and abroad. But back, I'd say a good 10 years ago and longer, corridor care was unheard of. Once the political changes occurred, i.e. Time and target, oh, we're going to see all patients within 4 hours, as if people are a production line and as if nurses and doctors are there, to rush round under 4 hours to get A, B, C, D, E, F, G done and deal with emergencies and deal with unexpected issues. It's just adding more and more pressure onto a system that's supposed to be based around care, around patient care. Anyway, that change, along with other political changes, such as waiting list, hospital beds, people who are in hospital beds as a result of either it's not safe for them to go home, there's nobody there to look after them, an elderly person breaking their arm, they're very, very limited for getting dressed, for moving around, for using the toilet, for cooking a meal. If they were struggling before, they're definitely going to struggle afterwards. If they don't have family nearby, or their family are away, or, they're just literally alone for whatever reason, they are incredibly vulnerable. And you can't just discharge them and leave them to have nothing. Now, once upon a time, like when I was a young staff nurse going back 30 odd years, 30 plus years, we had community services. We had district nurses. We had district auxiliaries, they were called. They're now called healthcare assistants. We had Meals on Wheels. We had home helps paid for by the council. We had a system in place, a community as well, neighbours, friends. Even the milkman, when we used to have milk delivered on the step, although that is coming back, I believe, somebody was there to keep an eye on people. So they knew if they were vulnerable, if they needed any help. That's gone. That has gone. Not everywhere, but in most places. It's not safe anymore to just discharge somebody back home because there just isn't any kind of support now. Very rarely neighbourly support. Sad society decline, I suppose. But the biggest issue for me as a seasoned nurse is corridor care is now the norm. It used to be the exception. It used to be very occasional, maybe for an hour or so, and then all of a sudden it's become the norm. I was in a situation, good number of years now, probably about 7, 8 years ago, where I was working at a hospital and we used to take turns as agency nurses for working in the corridor. And when you work in the corridor, you have an OBS machine, so something to take your temperature, your blood pressure, your pulse, your oxygen levels, and a list of your patients' names for the patients that are in the corridor. Now, a corridor in a small hospital can be as long as 10 beds. A corridor in a district general hospital is going to be 20, 30 beds, and it could be quite a long corridor. Now, on this corridor, we had in one night, this is just one episode, one shift, an old person who came in terminally ill, who died on the corridor, died, elderly, of cancer. There are no words. We had a 43-year-old man who was in the gym and developed chest pain, so he was placed on the corridor. And although his initial ECG or heart trace was normal and signed off by the doctors, he developed more chest pain. Couldn't find anybody to tell. I wasn't actually working on the corridor that night. I was actually somewhere else, but I know of this situation because I know the nurse who was on that corridor. And he died. He had a cardiac arrest and couldn't be resuscitated. There were 2 other people who deteriorated on that corridor and died later. Now, the hospital's answer to this was to put a suction machine, which is about the size of a large lady's handbag. It's okay, but it's not ideal. It's not like on-the-wall suction to keep somebody's airway and breathing flowing. And an oxygen cylinder on a wheelie trolley, a large oxygen cylinder and a mask of oxygen. And the hospital had designated the corridor as legally clinical, i.e. a legal clinical area. So solicitor, their insurance, whatever, at trust level, has now deemed the corridor at this hospital as okay to treat people. It's okay to leave people there. Now, when you see on the news, oh, patients on hospital corridors in pain, patients on hospital corridors who are sick, it isn't a case of them just waiting for a bed. Those patients need a toilet. Those patients need to wash their hands. Those patients need to freshen up. They might have been vomiting. Yeah? Where does that happen? Now, normally we'll have somewhere designated to take patients into. To wheel a trolley on your own as a nurse that weighs 70 kilos, 80 kilos, depending on the make, depending on if they've got massive oxygen cylinders on the bottom of them. They weigh a lot just on their own. And then add in a patient on top of that. So most patients are over 70 kilos, except small old ladies or small old gentlemen. But the majority of patients are heavy. So you're pushing a trolley, if you're on your own, of say 90 kilos plus a 70, 80, 90 kilo person on your own. You have to meander the thing through the corridor, through double doors, no help. Mostly you're on your own, mostly. I'd say 9.9 times out of 10 you're on your own. Into some doors or an area where there's a curtain, and it's all makeshift. So it's all wet wipes, bowls for patients who've been incontinent, patients who need changing because they've vomited, whatever the issue is, or they need to use a bedpan, or the gentleman needs to use a bottle to pass urine. That's it. That's all you have. There are even instances when a screen has been pulled round and a patient has had to use a bedpan or a bottle there and then in the corridor, covered over with their bed sheets. And in another hospital I was working at, I could talk about this all night and still never give you all the experience. I found a lady who was having a miscarriage in the waiting room and was feeling faint. Now, the nurse who was looking after that area and triaging or prioritising those patients was busy with patients coming in, so she couldn't keep an eye on the waiting room. It just happened to be that the friend who was with her was banging on the door, because all the doors are key card, swipe card. Members of the public just can't walk around. And I just happened to see this guy banging like fury on the corridor door. So when I said to him, "What's the matter?" he said, "My friend isn't very well. She's bleeding everywhere. She's feeling faint." And she was sat in a chair. So he wheeled her through on a hospital wheelie chair. We had nowhere to put this lady. Nowhere. There's a 24-year-old, 25-year-old, 20-something lady, and no privacy, no room. I had to go through 2 doors, and I'm not alone in this. This happens to my colleagues as well. into a disused kind of old operating theatre area, because the hospital's actually closing down, that the hospital patients are going to have to go quite far to another hospital. So this hospital I was at wasn't even modern. It was like falling apart, like most of them are. And it was an old operating theatre with like tiles on the floor, looked like it hadn't been used since about 1981. And I had to put a bed sheet, because there were no blankets, on the floor. And her friend, a colleague, one of the paramedics, and myself lowered her onto the bed sheet, and I got some drips in, got some bloods off, managed to get a doctor who was also busy. Our doctors were all tied up, and get gynecology surgeons to come and see her. Now, I shouldn't be working like that. The patient shouldn't be put in that position. To have a paramedic holding a drip that I'd put in, having somebody else take some bloods to get them off in a chute to go to the lab urgently, to get me a bag of saline, to get me equipment, and I'm kneeling on a cold floor with a patient on a bedsheet who's profusely bleeding. Resus was full, corridors were full, majors was full, everywhere was full. Ambulance triage was full. Now, that night, the nurse in charge actually called the hospital manager, who was in charge of the hospital that night, to get the trust executive in. And he came in and just looked around. Oh, yes, yes, we'll have a meeting about it. Disappeared sort of 20 minutes later. The next day was the same, and the same after that. And it went on and on and on for weeks and months, as it does in many hospitals. And I've worked in many hospitals up and down the country, from Scotland to Wales, all the way down to Greater London, Nuneaton, various areas, lots and lots of different hospitals, Midlands, West Midlands, East Midlands, North West. Like many of my colleagues, we're based there, and we see the same old things time and time again. Corridors full of patients, people sick, people unable to get pain relief, people unable to use a toilet, people who are sat with their relatives, and the relatives are, not getting a drink, not getting anything to eat, and the same with the patients who can eat and drink. It's very, very rare you'll have enough food, enough sandwiches, enough anything, to be quite honest. Often we run out of milk, even for the staff to have a cup of tea. There's nothing. There is no backup. We have to wait for a porter, and we've only got a couple of those on at night. Nighttime, you're very, very restricted as to staff numbers for anything, for cleaners, for porters, for any staff. Nights is seen as everybody goes to sleep and the hospital's quiet. Well, that's not the case. There are reduced services at night. So a porter going to get milk is low down on the priorities when you've got someone who needs x-ray, someone who needs to go to MRI scans, someone who, needs to go to the ward, and you've only got one porter. So who does it fall on? The nurses. So there's a nurse pushing trolleys, not only for hygiene and care, but also to theatre if it's an operation like the lady who was bleeding, or to MRI scan, or to x-ray, chest x-ray. It's a disgrace. That's all I can say, having worked and still working occasional frontline. It's a disgrace. It never used to happen. And another issue that happens, and I'll end on this note, is nighttime used to be for sleeping on wards and departments. Now, sleep is not a situation that is preserved anymore. Patients are moved, patients are discharged, patients are shifted from one ward to another to make a new bed. Patients aren't allowed to sleep anymore. They did sort of sleep in the past when it was quiet, when it was Nightingale wards, and we were sat as students or as newly qualified nurses on a little desk in the middle of the ward. Patients did get some sleep and some rest, and they were given good care before all these political measures were brought in. Now, no, that doesn't happen. There's just too much going on, too much shuffling of beds, too much chaos because you're trying to get people out the door, even at 3 a.m., to make a bed space because someone's in a corridor. This wouldn't happen if the government of the day, which happened, this was in the early 90s, stopped and sold off convalescent homes, convalescent hospitals, people who needed rehab, the elderly, physiotherapy, occupational therapy, to help them if they've got arthritic hands, how to use a way of opening cans or lifting pots and pans, or how to walk, devices and things to help them be independent. That's gone. The days of taking people where the old convalescent homes were, where people were cared for, rehabilitated, and then sent home when they were fit to go home, have gone. The government of the day, Virginia Bottomley being one of them, sold off those hospitals. They sold off the psychiatric hospitals and their land for buildings, say no more. They sold off the convalescent homes and the land it was on for buildings, say no more. And all those services, the ambulances, the patient transport that used to take a group of patients from a ward, patients who knew each other as well, to the convalescent home and then rehabilitate them to their homes with their families, it's gone. And in my opinion, it's on purpose to create this constant backlog so that the NHS appears to be failing. And I'm saying that as a seasoned registered nurse. I've worked in management positions, operational and strategic. I've worked on the floor as a registered nurse my whole career so that I didn't lose touch with patient care, because I liked patient care. I've taught nurses. I've done lots and lots of things, post-basic training, and I actually loved my role. I really loved my role with the patients. It's a nice career to have if it's in the right service. If it's a service, not a business, that's what I mean to say. If it's a service, not a business. Nye Bevan set up the National Health Service as a service, not the National Health business, not the National Health, let's have IT, let's have this, let's have that. No, it doesn't work. Everything is obsolete in terms of computers, in terms of IT, before it's fit for purpose. I think there could have been a discussion about the right way to do things, and having paper notes might seem old school, but it works. It doesn't have to all be paper, but some, especially in an A&E, can be. And then it can be put on the system by clerks at a later date, not by registered nurses who are doing admin, who are doing portering jobs, who don't get breaks. It's a crazy, crazy mess of a system. And there is one thing that would change all this overnight. But I'll leave that till next time, because this one thing that occurred has created this chaos in the NHS. And as for the money, that's another issue. Money to the NHS, that's a topic for another day. Anyway, enough of my discussions as a seasoned registered nurse. I'll leave it there. Thank you for listening, and see you next time.